Welcome to Law and Justice. I'm Jane Mulcahy. This is a special series on the topic of how to talk policy and influence people. And today I am joined by Dr. Charles Nelson from the Harvard Center on the Developing Child. And thanks so much for joining me, Dr. Nelson.
My pleasure to be here.
Thanks very, very much, because I know you're super busy. Can you tell me a little bit about yourself, Dr. Nelson, and your professional background, please?
Sure. So I was originally, when I was in university, I studied psychology and started doing more child psychology as I went to graduate school, and then became very interested in neuroscience. So I essentially retrained in developmental neuroscience. So I feel that I live in both worlds, both child development and developmental neuroscience. And over the course of my career, I've studied any number of things that have to do with how brain development leads to changes in behavioral development. And the last thing is that I'm particularly interested in how experience impacts development. And so I look for opportunities to see how children growing up in different environments who have different experiences, how that impacts their brain and their behavioral development.
And what types of projects are you currently working on in your lab, Dr. Nelson?
So there are a few, and some are perhaps going to be more relevant to your show than others. One is focused on adversity. So I'm interested in how bad things that happen to children early impact the course of their development. They can be biological things like malnutrition. They can be psychosocial things like being brought up without parents. Some of the work is international. So for more than 20 years, I've studied babies who've been abandoned to orphanages in Romania and then raised in orphanages. I have a big project in Dhaka, Bangladesh, where we're studying children growing up in a slum there to look at the effects of all kinds of hazards, biological and psychosocial hazards. And then here in Boston, I study children growing up in low income, low resource households, often with mothers who are very, very stressed, to see the impact that has. I have a line of work focused on autism. And the reason is that I'm interested in when brain development goes awry and we can make the brain go into an atypical direction with the experience, but also there are certain genetic or prenatal conditions like autism that lead brain development to go awry. So my interest there is in predicting who will develop autism in infancy. Usually you have to wait until the children are a few years old before I do that. And then the last project that I'll just briefly talk about is we want to know, are there things that we see in infancy that would predict which children would develop a problem with anxiety or depression when they're school age? So again, it's another longitudinal study, meaning we study the same children over time. And the goal is measures that we obtain in the first months of life, will they predict when children are, say, 5 or 7 years of age, who will wind up with anxiety? This is a very common problem. In our sample of 800 kids, 18% by the time they're 7 have an anxiety disorder of some sort.
Wow.
So it's a worldwide problem. So those are the 3 areas I'm mostly working on now.
Thanks so much for that. It's very fascinating work. I suppose one of the reasons I was keen to speak to you was because of my increased interest over the last few years in toxic stress and attachment and early life trauma. And I was just wondering, do we know much about the impact of stress during pregnancy? So for example, if a pregnancy is unwanted, maybe because of rape or being an unwed mother in Catholic Ireland back in the day, where it was highly stigmatized, or it's otherwise stressful because of ongoing domestic abuse. Can that have a negative impact on the developing fetus, Dr. Nelson?
Right. So the answer is yes. Most of what we know historically has been postnatal stress exposure, but increasingly we're paying attention to prenatal exposure to stress. And leaving aside the examples you gave, there's no better example right now than the pandemic that's ravaging the world. And in fact, we are currently studying babies whose mothers had COVID-19 during pregnancy. So briefly, what we know is that when mothers are very stressed during pregnancy, they're releasing stress hormones, and their ability to regulate their stress becomes less productive or less, I'm at a loss for words, they have a harder time regulating their response to stressors. These things can target different regions of the fetus's brain. So for example, there are areas of the brain that have what we call receptors for these stress hormones. Mm-hmm. And if those stress hormones are too elevated, it can actually damage those parts of the brain. So there's now evidence that mothers in, say, the second or third trimester who are exposed to high levels of stress have fetuses who at birth, or even if they have MRIs performed as a fetus, which is not an easy thing to do because you have to get the pregnant woman in the MRI scanner, they show differences in their brain. So there's no doubt that prenatal stress has an impact on fetal brain development. Your examples are even more insidious than mine, though, because there's the acute trauma, and then there's the, in a sense, the continued trauma. And then if you think back even further in Ireland, if you think of the Troubles, then there's the issue of the intergenerational transmission.
Right.
And that's an area of a lot of interest right now. So from one generation to the next, are those things transmitted? But I think the storyline is that we need to pay very close attention to prenatal stress, and because it has policy implications. For example, what support should we put in place to help women during pregnancy who are very stressed, like living through a pandemic?
Mm-hmm. Indeed, it's fascinating. As someone who's a mom myself, just thinking back, you've so little control over things like no control over a pandemic. And then there was a report recently, which you may have heard about, the Mother and Baby Homes report in Ireland, which found that there were really, really high rates of infant mortality in these institutions where unwed moms and their babies were held. And it brought to mind some of Spitz's findings to me from the 40s and early 50s about high levels of infant mortality there too. Do you think, Dr. Nelson, that there's any link between what Bruce Perry and Maya Salovitz call skin hunger due to emotional deprivation and these high rates of infant mortality? Or is it more just that they weren't fed properly, maybe?
No, I mean, of course, we have to consider the possibility that some were starved, but leaving that aside, even in the lab we have in Romania, we found the book dating to the late 1800s, where they entered the name of every infant abandoned to that institution. And the mortality rate through the 1930s was approaching 50%.
Wow.
So we know that, and if you think again of Spitz's work, that children who are raised in these profoundly deprived, socially isolated conditions can lead to depression, and it can lead, we don't know the cause of death, but I'm not the least bit surprised at the very high rate of infant mortality. And it has to do with profound psychosocial deprivation. There have been studies that have tried to mimic this in monkeys, and you see the same thing. Baby monkeys who are deprived of caregiving become listless and what basically looks like depression. Why they pass away, we don't understand. But we know, but I'm not surprised I remember seeing the report you just mentioned at the high rate of mortality.
Yeah, it wasn't something that drew massive comment, in relation to this, the profound psychosocial deprivation. But maybe you can tell me a little bit more about some of your own findings from Romania about the impact of psychosocial deprivation, especially on infants, I guess.
Right. I mean, what was powerful about the work we've been doing is that we didn't simply look at how babies develop who were abandoned to institutions. We actually did an intervention, and this might bring it back to the policy discussion. So we started with a large number, several hundred babies who had been abandoned to institutions, but then we took half of them and we put them into good foster care that we built, and then half remained in the institution. And we could do that because we could find only a small number of foster care families, so there was only so much to go around. And then we had children who grew up in families, had never been in an institution. And we've now followed them for 20 years. And briefly, the children who were assigned to remain in the institutional group have lower IQs, they have profound disturbances in attachment, in how they relate socially to other people. Their executive functions or their higher cognitive functions are also compromised. As they get older, they can't regulate their response to a stressor, they can't make friends, and they have very high rates of psychopathology. The children that we put in foster care generally improved in most ways. They didn't necessarily always look as good as the never institutionalized children, but they looked better. But one of the things that regulated that was the age at which they were placed. Mm-hmm. So if they were placed before 2, they had better outcomes. And so the recommendation has been we should avoid placing children in institutions if at all possible. And if it's not impossible, they have to go, keep them there for as short a period of time as possible, but certainly get them out of there before they're 2, probably even younger than 2.
Yeah, fascinating and kind of frightening findings in a way, seeing that we all begin as babies and right. Like to think maybe that what happens in infancy has little or any impact on us. What implications do those findings have, do you think, for adoption sure. policy and practice and law?
Right. So it's a great question, since just 2 nights ago, I lectured in Professor Bartholet's class at Harvard Law School on this very subject. So let me start with Romania and then expand beyond that. Mm-hmm. In Romania, what the findings did is convince the government to stop putting kids in institutions. So they passed legislation forbidding the institutionalization of children under 2 or 3. They started closing down institutions. So those are 2 things. A second, worldwide, is the World Health Organization and UNICEF have both used this study as its strongest evidence to convince governments to stop putting parentless children in orphanages or institutions. Instead, they should be with families. Mm-hmm. Third, I think that the political part is the issue of international adoption. And so I think that many countries have banned international adoption, including Romania, although in my view, they did that without thinking of what was in the best interest of the children. So domestic adoption would be preferred over international adoption. But if the alternative is institutionalization versus international adoption, I would always go with international adoption. Mm-hmm. And then finally, in terms of adoption generally, the big advantage of adoption over foster care is it's a permanent placement. So I think we have to be thinking what's really in the best interest of these children is to be taken out of a bad environment and put into a permanently good environment, and work with a family who really cares for that child. So those are the implications, I think, for adoption.
Thank you, Dr. Nelson. Do adoptive parents know enough about things like attachment and the importance of, I suppose, nurture and care and interpersonal sure. neurobiology? And what more can we maybe do to support people who may want to adopt a child from Romania or Russia or
right.
China?
Right. So I think there are 2 categories. One is, I think we need to prepare parents that the child that they may adopt may struggle with some developmental issues, and they might need some resources, and the child might not be the ideal child that they have in their head. All parents, as you know, you're a mother yeah. and I'm a father, we all have this idealized child in our head, and then they become teenagers, and then they're no longer that idealized yeah. child, right? So I think that we need to educate parents that there may be children's developmental history might make them different than what they expect. Second, we need to provide resources for these families. We certainly did that in Romania. We had a whole team of social workers and psychologists who helped the families with their children. So we need to provide resources to those families. And I think another may be that we might need to start thinking about different types of interventions. And I'll give you an example in a moment. So we often assume that by placing a child in an adoptive family, loving that child will be enough. Mm. But the reality is that it's more complicated, and that these children may have a number of developmental issues that require specialized intervention. So in our work in Romania, 20% of the children have attention deficit disorder.
Okay.
And placement in foster care had no impact on that, which surprised us. So now that we know that attention deficit disorder is so common among previously institutionalized children, or attachment issues are so common, we need to keep that in mind and try to target those things early on, so we help children develop in a healthier way without ADHD or without attachment problems.
Okay, and is medication the answer for children diagnosed with ADHD there from institutional settings, or are there other ways? For example, I don't know if neurofeedback training might be used with those types of children, or whether it's more basic than that. For example, I know as well that maybe being overly affectionate to a child who's not used to being touched might also create problems, and parents might take that as a rejection of them. Right. Is there an element where people just need to not take behaviors personally as well, and see it as a failure in the care that they're giving sometimes?
Right. So let me unpack that. There's a lot.
Yeah, sorry. There's a few questions going together.
So first, I think, again, having educate the parents about the child's developmental history. Now, that's not always easy, because sometimes adoptions are, parents may never get to see their child until they show up in a hotel room. Mm-hmm. So they may not know their developmental history, but as much as they can get, they should get. They should recalibrate their expectations. In terms of treatment, I think that for some things like ADHD, the first treatment, of course, is behavioral. Before you go to drugs, you try to, are there things, for example, setting limits and providing a structured environment helps children regulate their own emotion. But if parents don't set limits, and if it's an unstructured environment, that's a pathway to problem behavior. Mm-hmm. So rather than just medicate, you would try to change the environment first. Now, when all of that is done, you've changed the environment, the parents have been given help in parenting, then maybe medication might be appropriate for children with ADHD, but it kind of depends. But there are the bigger problem is attachment problems. Mm-hmm. There are no medications for attachment problems.
Right.
And this is what often is very difficult for parents, because they do feel rejected. Their children behave in a way that makes them think their children don't love them. And that's difficult for someone who's just adopted a child. And there are not a lot of treatments, but there are some specialists who really do appreciate how sometimes parent-child therapy can be effective in helping those sorts of things. But attachment problems are probably the biggest issue that parents face, mm-hmm. and the more difficult to treat.
And I guess, as you say, depending on how long the child was institutionalized without any real kind of nurture and care, probably the more difficult the attachment issues might be.
That's right. And part of that is that children in institutions don't form attachments because they don't have consistent caregiving. So and if they get through what we call the critical period for forming attachments, which is sort of between 12 and 24 months, then it's going to be increasingly difficult for them to form healthy attachments. They may form some attachments, but they may not be healthy. They could be what we call indiscriminate, meaning they'll form a relationship with anybody, including a complete stranger.
Right. Okay. The previous US president ordered the separation of children, including babies, from their parents at the borders as part of official immigration policy. Dr. Nelson, are you concerned about the long-term harm that practices such as this would have for children, especially very, very small, vulnerable children and babies?
Yes. So briefly, having been involved in several of the legal cases that were brought against the Trump administration, I can speak with some authority about the hazards that these children face. And when the news first broke about this, which was roughly May of 2018, when I was interviewed by journalists, I said, my biggest worry is that these children could develop significant psychological problems up the road. And then a year later, when I started testifying in court cases about this, when psychologists evaluated these children, sure enough, that's what they saw. So it was leaving aside the immorality of that policy, it was almost a guaranteed way. It's like they looked at the scientific literature and thought, if I really wanted to cause psychological disturbances in the child, what should I do? Well, I'll separate them from their parents.
Right.
And what this doesn't take into consideration is often these children were leaving areas where had already been traumatized. Mm-hmm. So they were leaving an area where there were gangs or there was other violence. Then they have a long journey to the border, and then they get separated. And so it was like a confluence of factors that collectively led to a disaster just waiting to happen. And the longer the separation occurred, I'm not sure you're aware of this now, but there are still hundreds of children in the US they can't locate. They don't even know where they are. Yeah. They can't find their parents. So the longer the separation, the greater the harm to the child.
Yeah, it's extremely grim. Because this show is really thinking about policy, but in the broadest possible way, and the interconnectedness of various policies, even though we don't always see them as interconnected. I'm just wondering, what public policies do you believe are most in need of attention in America right now?
Well, we need to stop the policy of separating parents from children at the border. I think that we need to provide more supports for families, particularly during this pandemic. This has been extraordinarily stressful for families. Children are socially isolated, they're not in school, families they have lost income. A group of us have been preparing a manuscript to submit to a scientific journal, which will happen today, where we report that our estimates are currently that there's 1 million orphans left as a function of this pandemic.
Wow.
If you look at the UK and Wales and Brazil and the United States and South Africa, the countries with the biggest numbers, the estimate is 1 million orphans have been the result of this pandemic. So we need to provide supports for these families. And I think that we need to look ahead and think, will the harms these children have experienced now persist? And therefore, we may need to make long-term commitments to supporting these families, not just the short-term commitments.
Mm-hmm. Just one final one on human rights. Do you think that America can maybe do more to prioritize the rights of children and see them as unique rights holders aside from what their parents might have done or their right to be in America or whatever else? Is that an important thing going forward, do you think, Dr. Nelson?
Sure. So, I mean, we could use the expression, you lead by example, or from a parent's perspective, parents have to model good behavior. Mm-hmm. And the same goes for countries. So if we want to be a leader in investing in children, we need to demonstrate that ourselves. We have to live that ourselves and model that behavior. And we're in no position to judge other countries if we ourselves are doing such a poor job. And the last 4 years, we haven't done such a great job. So I think there's a lot we can do here to help. And again, I think it has to do with, that old maximum that children are, or the investment in our future. Well, we need to take that seriously. And I think that there's a lot more we can do. We have children growing up in profound poverty who had the food insecurity, no less malnutrition. Yeah. They have the parents may have untreated mental health issues. Children may have behavior and emotion problems that aren't getting any attention. There's a long list of things. So I think we can do much better. And I'm optimistic that with the current administration, that will happen. Knowing some of the people who've been appointed to these high-level positions, I trust that they know exactly what they need to do.
Well, that's an encouraging place to end. I feel hopeful as well. And I'm married to an American who's been following the media with kind of immense stress over the last 4 years. But Dr. Charles Nelson, thank you so much for joining me and talking to me about your fascinating, important research.
My pleasure. It was delightful to talk to you.
Thank you. All the best. This has been How to Talk Policy and Influence People with me, Jane Mulcahy, and my guest today was Dr. Charles Nelson.
Thank you very much.
Thank you.